saw it appropriately and picked up a folder.
This is the first international conference that we've held here, and we're looking at functional neurological disorders.
Are we missing something here?
A medical conference in and of itself isn't groundbreaking, but when you are breaking new ground, challenging a status quo, the world shows up.
They actually screened 25,000 patients in 14 different countries.
These are basically conversion symptoms again.
Global experts on functional neurological disorders, FNDs, attended Emory Brain Health Center's inaugural International Conference.
Made possible through the philanthropy of Mark and Barbara Klein.
And I know many of you have traveled quite far to come here.
From movement disorders to seizures, FNDs defy conventional diagnostic tools. Gretchen Granado's seizures, thought to be epileptic, were not. The difficult truth was that her condition, although very real, didn't show up on traditional scans, leading doctors to tell her, and thousands of people like her, it's all in their heads.
I was very shocked to hear that all of these symptoms that were very real to me and were happening in my body were not real.
It wasn't until Granados came to Emory Brain Health Center that she got better.
Instead of just having psychiatrists looking at a problem or neurologists looking at a problem, we have medical doctors, we have ethicists, we have basic neuroscientists, we have patients and their families, all working together to figure out what to do.
In Granado's case, with cognitive behavioral therapy, her seizures stopped.
I had spent so many years not wanting to admit that things had an effect on me, until my body said, well, if you're not going to acknowledge it, we're going to force it out,
The interesting thing is that functional neurological disorders is the tip of the iceberg. There are many people that have physical symptoms where we don't understand the etiology of it. And because of that, we tend to blame the patient, because we haven't figured it out or because we don't know the best way of treating these people. That's why this conference is so important. Functional neurological disorders are legitimate disorders, just like Alzheimer's disease is, just like depression or schizophrenia. They're legitimate disorders. We're just not smart enough now to know the best ways of diagnosing or treating them.
The brightest minds in the field striving together through compassionate science to heal people so that one day they can say,
I feel like myself again.
Jay Watson for Emory Brain Health Center.